These are the step-by-step process before doing the physical assessment. 1. Wash hands before the procedure to avoid spread of microorganisms. 2. Prepare the room for examination including all equipment needed. 3. Introduce yourself and explain the procedure to the patient. 4. Check the patient's hairstyle and jewelry, or other things that may interfere with the assessment. Remember, use a therapeutic approach throughout the examination. Practice proper draping technique by exposing only the body parts being examined. And utilize proper physical examination techniques and sequencing of the head-to-toe examination. 5. Assist the patient in assuming the proper position. Ensure the patient's privacy. Let us now proceed with the actual physical examination. Start by conducting a general survey. Assess the patient using the sometimes mnemonics. S for symmetry. Assess if the face and body are symmetrical. O for old. Check for appropriateness of the patient's age to his or her appearance. M for mental acuity. Check if the patient is oriented to the 3 spheres: person, place and time. E for expression. Check the facial expression and the current mood of the patient. T for trunk. Assess the patient's upper body. Check if lean, obese, or barrel-chested. E for extremities. Assess for any deformities, edema, and tenderness along the upper and lower extremities. A is for appearance. Assess the patient's general appearance and grooming habits. And M for movement. Check the patient's posture and gait. S for speech. Assess how the patient speaks. Take note of the clarity, pitch, and tone. Check for other conditions such as slurred speech. The skin. Inspect the skin color, uniformity, edema, and presence of lesion. Palpate skin moisture and temperature. Compare the 2 feet and 2 hands using the back of your fingers. And note the skin turgor and perform a Blanche test to test capillary refill. The head. Inspect the symmetry, size, and the contour of the skull. There should be smooth scalp, no lesions, and no infestation of lice. The hair must be evenly distributed over the scalp. Palpate the skull for nodules or masses and depression by using a rotating motion. Begin at the front and palpate down the midline. The eyes. Inspect the eyebrows for hair distribution and alignment. Then ask the patient to raise and lower the eyebrows to assess for movement. Inspect the eyelashes for evenness of distribution and the direction of curl. Inspect the eyelids for surface characteristics. Assess the skin quality and the texture. Check the ability to blink by asking the patient to do so, and note its frequency. Inspect the lower eyelid while the patient's eyes are closed. Next, using a penlight, inspect the pupils for color, shape, and symmetry of size. Both pupils should be black in color, normally 3 to 7 millimeters in diameter, round with smooth borders, while the iris are flat and round. Assess each pupil's direct, consensual reaction to light. This is done to determine the function of the 3rd and 4th cranial nerve. The illuminated pupil should constrict as a direct response, while the non-illuminated pupil constricts as a consensual response. Assess each pupil's reaction to accommodation. The pupils constrict when looking at a near object, and converge when the near object is moved toward the nose. Lastly, to test the visual fields, extraocular muscles and eye alignment, perform the corneal light reflex test. To do this, instruct the patient to follow your index finger with their eyes only. Their head must remain facing forward as you first move the finger to either the extreme right or left. Once you have the patient looking out laterally, have them follow your finger as you move it first up, then down. Then move your finger across to the other side and repeat. Your path should trace out the letter H. At the end, bring your finger directly in, towards the patient's nose, the ears, Inspect the auricles for symmetry, color, and any deformities. Palpate the auricles for texture, elasticity, and areas of tenderness. Using an otoscope or a pen light, inspect the external ear canal for cerumen, skin lesions, pus, and blood. Inspect for color and the gloss of the tympanic membrane. Tilt the patient's head slightly away from you, toward the opposite shoulder. For adults and older patients, pull the pinna up, then back. Meanwhile, for infants and children under 3 years of age, pull the pinna down, then back. Hold the pinna gently and firmly until you have finished the exam. Next, assess the patient's response to normal voice tones. Proceed with the Weber test and Rinez tests if the client has difficulty hearing the normal voice. In doing the Weber test, tap the tuning fork strongly on your palm. Then press the bottom of the instrument on the top of the patient's head, in the midline. Ask the patient where they hear the sound. Normally, the sound is heard in the center of the head or equally in both ears. Meanwhile, in performing the Rinez test, strike the tuning fork and place it on the patient's mastoid process to measure the bone conduction. Caution the patient to listen to the sound and not the vibration. Once the patient claims not to hear any sound, quickly test whether the sound can be heard when placed close to the ear canal. Normally, the sound is heard longer through air than through bone conduction. The nose. Inspect the external nose for any deviation in size, shape, and color. Note for flaring and presence of discharge coming from the nares. Determine any size of tenderness, masses, and displacements of bone or cartilage. Next, determine the patency of nasal cavities. Do this by placing your finger over one nostril to occlude the airflow, then ask the patient to breathe in and out through their nose. Note the degree of airflow, then repeat with the other nostril. A reduced airflow through a particular nostril may indicate the presence of something blocking that air passage, such as a polyp, a deviated nasal septum, or a foreign body. Lastly, perform the smell test by allowing the patient identify different scents on 2 or more vials or cotton balls. The mouth and the throat. Inspect the outer lips for the symmetry of contour, color, and texture. Inspect and palpate the inner lips and oral mucosa for color, moisture, texture, and presence of lesion. Inspect the teeth and the gums, while examining the inner lips and oral mucosa. Also assess the use of dentures and dental braces. Inspect the surface of the tongue for its position, color, and texture. To assess the tongue movement, ask the patient to protrude the tongue and roll it upward. Then, ask the client to move the tongue from side to side. Then palpate the tongue and the floor of the mouth for any nodules, lumps, or excoriation. Lastly, use a pen light to inspect the throat. Observe the oval, rough surface tonsils that should be pink with indentations. Depress the tongue with a tongue blade to enlarge the view of the posterior pharyngeal wall. Push halfway back on the tongue, then push slightly off the center to avoid eliciting the gag reflex. The neck. Inspect the neck muscles for swelling or any abnormalities. Observe the head movement and the muscle strength. Palpate the entire neck for enlarged lymph nodes and check for the range of motion by letting the patient's chin touch both shoulders and the chest. The chest and the lungs. Perform the examination following the sequence of inspection, palpation, percussion, and auscultation. First, inspect for the symmetry, skin color, retractions, and deformity. Then, palpate in order to identify the tender areas, masses, or sinus tracts, as well as any chest excursion and tactile fremitus. Next, percuss the areas of the chest. Percussion of a body part produces a sound, like playing a drum. This indicates the type of tissue within the organ. With a warmed head of a stethoscope, proceed to auscultate the chest to identify the lung and heart sounds. First, ask the patient to repeat the word 99 while you listen with the stethoscope. A muffled sound is considered normal, while a clear sound may indicate a certain condition. Second, have the patient repeat a long ee sound. A long ee sound should normally be elicited. A long ia sound is considered abnormal. Lastly, have the patient whisper 1, 2, 3 as you listen. The sound should be faint to inaudible, while clear and distinct are abnormal.
Ngayon naman po, letter D. Ngayon naman po, magulang po na 1, 2.
The abdomen. Ask the patient to lie on a level examination table that is at a comfortable height for both of you. Take a bed sheet and drape it over the lower body. This allows to fully exposing the abdomen while at the same time providing privacy to the patient. The patient's hands should remain at their sides with their heads resting on a pillow. If the head is flexed, the abdominal musculature becomes tensed and the examination is made more difficult. When the patient is ready, perform the abdominal examination following the sequence of inspection, auscultation, percussion, and palpation. First, inspect for the contour, symmetry, umbilicus, skin, pulsation, and movement. Second, the auscultation is made by gently placing the pre-warmed diaphragm of the stethoscope on the abdomen. Listen for 15 to 20 seconds to note the presence of the patient's bowel sounds, its frequency, and nature. Third, perform the abdominal percussion. Remember to rub your hands together and warm them up before placing them on the patient's abdomen. Place your left hand firmly against the abdominal wall, such that only your middle finger is resting on the skin. Strike the distal interphalangeal joint of your left middle finger 2 or 3 times with the tip of your right middle finger. There are 2 basic sounds which can be elicited. These are tympanic and dull. Lastly, perform the abdominal palpation. The pads and tips of the index, middle, and ring fingers are the examining surfaces used to locate the edges of the liver and the spleen, as well as the deeper structures. You may use either your right hand alone, or both hands, with the left resting on top of the right. Apply slow and steady pressure, avoiding any rapid or sharp movements that are likely to startle the patient or cause discomfort. Examine each quadrant separately, imagining what structures lie beneath your hands and what you might expect to feel. The upper and lower extremities. The examination is performed to assess for reflexes, balance, and range of motion. To test for Babinski reflex, stroke the bottom of the patient's foot with the object in a curved line, moving from the heel of the foot up toward the toes and over to the big toe. Check for tendon reflex of the arms and the knees. Afterwards, perform a strength test. Start by asking the patient to move through an active range of motion wherein the joints are moved by the patient. If absent, proceed to perform a passive range of motion wherein the joints are moved by the examiner. After the physical examination. 1. Assist the patient to a safe and comfortable position. 2. Do an aftercare of all the equipment and supplies used. 3. Perform hand hygiene to prevent spread of microorganisms. 4. Document the physical assessment data accurately. And 5. Refer any significant findings to the client's attending physician.